This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, September 23rd, and I'm Zach Caruso. Our lead story this week is from the American Journal of Psychiatry and is titled Contingency Management for Stimulant Use Disorder and Association with Mortality, a Cohort Study. This national retrospective cohort study found that veterans with stimulant use disorder who received contingency management, or CM, were 41% less likely to die in the year following treatment initiation relative to matched comparison subjects. These findings provide the strongest real-world evidence to date that CM is associated with reduced all-cause mortality, underscoring its potential as a life-saving intervention in routine care. Results support expanding access to CM across healthcare systems and public health settings. Next is an article in NEJM titled Medications for Opioid Use Disorder in County Jails, Outcomes After Release. This is an observational study that used linked state-level data to analyze outcomes for individuals with presumed OUD in carceral settings who did or did not receive MOUD from county jails participating in pilot programs to offer MOUD. Of 6,400 individuals in the study, 42% received MOUD in jail. Among those treated with MOUD, 67% received buprenorphine, 25% received methadone, and 6% received extended-release naltrexone. Disparities existed in MOUD receipt in jail. Participants in the MOUD group were more likely than those in the non-MOUD group to be white non-Hispanic. Treatment with MOUD while in jail was associated with higher initiation, engagement, and retention in community MOUD after release. Receipt of MOUD in jail was associated with lower post-release risk of fatal overdose, non-fatal overdose, death from any cause, and reincarceration. Next is a study in drug and alcohol dependence titled Use of Stigmatizing Language Related to Substance Use Disorders in Media, a Systematic Review. This is a systematic review of peer-reviewed publications examining stigmatizing language within media channels. 13 studies were included covering digital news, video-based, and social media. The use of stigmatizing language was frequent across these different media types, with common terms being addict, abuse/abuser, and junkie. Stigmatizing language was more prevalent in news media than other types. Findings were less consistent regarding trends in stigmatizing language over time. While there were identified decreases in stigmatizing language, this was not consistent across contexts. Our next article is in the American Journal on Addictions and is titled Persisting High Rates of Mental Health Disorders in Patients in Opioid Agonist Treatment, Results from a 6-Year Longitudinal Study. SUD and mental health commonly co-occur, and to better understand this overlap and treatment, researchers used longitudinal data of patients receiving MOUD to evaluate changes over time. Many patients had at least one mental health diagnosis other than SUD, with depression and anxiety being the most common. There was a small increase in percent of patients without a psychiatric diagnosis over the study period. Psychiatric treatment rates for the mental health comorbidity were very low at baseline and decreased by end of study period. This study highlights the need for psychiatric and psychotherapeutic treatments for this population and potential of integrated care models. Next is a study in substance use and misuse titled Methadone Program Directors' Perceptions of Barriers and Supports to Engage People with Opioid Use Disorders in Methadone Services. Researchers interviewed program directors of methadone treatment programs to assess barriers and enablers to access methadone treatment. Significant barriers identified include staffing and a need to invest in this workforce, including changes in reimbursement structures for programs. Another barrier was decrease in patient demand, which they attribute to changes in drug supply and perception methadone may not work for fentanyl and xylazine, and a preference for alternative medications with less treatment requirements. The directors did note changes in relaxation, with increased take-homes having improved patient satisfaction. The directors recommended rapid titration of dosing at initiation, and increased resources to address basic needs and social support would improve treatment and access. Our next article is in Drug and Alcohol Dependence and is titled The Day After Binge, Electrophysiological Correlates of Attention and Working Memory Processing the Day After Hazardous Alcohol Intake. This study assessed the effects of binge drinking, or BD, on brain function using EEG data. University students were labeled binge drinkers or controls. The EEGs were recorded during a cognitive task requiring recognition of abstract figures presented briefly on a screen. BDs were studied during a hangover following an episode of BD and on a non-drinking day. During the hangover state, BDs compared to controls showed reductions in EEG amplitudes corresponding to impairments in attention and memory processing. On non-drinking days, BDs showed increases in EEG amplitudes corresponding to recruitment of additional neural resources, suggesting a compensation for an underlying neural deficit. These results demonstrate acute neurocognitive deficits during a hangover and raise concern about cumulative long-term effects of BD. Next is an article in American Journal of Psychiatry titled Ketamine for Depression, but at what cost? A review of ketamine's neurotoxic effects from preclinical and human studies. This review article examines data from both basic and clinical research to address a need for systematic reviews concerning the relevance of potential toxicity for the therapeutic use of ketamine. While there is evidence consistent with neurotoxic effects when ketamine is used in relatively high doses, these doses are higher than used in most clinical applications, and there was no clear evidence of neurotoxicity for doses in the clinical range. Our final article is in the Journal of Addiction Medicine and is titled Problematic Use of Buspirone and Tendospirone, a Scoping Review. This review produced 9 experimental studies designed to assess the misuse liability of buspirone, comparing it to sedatives or placebo. Most of the participants in these experimental studies had a history of problematic alcohol or sedative use. The experimental studies showed buspirone to have little reinforcing effects and was described as producing tension, anxiety, and nervousness. Benzodiazepines were strongly preferred over buspirone. There were 4 case reports of problematic use. All 4 patients had a history of SUD, 2 had schizoaffective disorder, and 1 had schizophrenia. In 1 patient, psychotic symptoms were exacerbated by buspirone. 2 began use during incarceration, where buspirone misuse was reported to be widespread. Accounts in online forums confirm the prevalence of buspirone misuse in incarcerated populations. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.